First I'm starting off by checking your skin. Skin is appropriate for ethnicity. I'm feeling your scalp. I'm feeling for bumps, looking for any lesions. Everything looks good. Next I'm gonna check your temporal pulses. Equal bilaterally. Can you raise your eyebrows? Can you frown? Can you squeeze your eyes tight? Smile real big, show your teeth. Puff out your cheeks. Good. Now I'm feeling your temporal mandibular joint. Can you open and close your mouth? Feeling for any popping, clicking, any discomfort. Good. Next I'm gonna ask you to close your eyes and tell me where you feel this cotton ball.
Where?
Yes.
On my forehead. Left cheek. Right cheek. Left arm. Right arm. Left leg. Right leg.
Okay. Good. You can open up your eyes now. Alright, now I'm checking your eyes, I'm checking your eyelashes, your eyebrows. I don't see any redness or swelling. Eyebrows are equal. I'm gonna pull down here. Can you look up? To the right? To the left? Sclera white, conjunctiva pink. Everything looks good. Now I'm gonna ask you to follow my finger with your eyes. Do not move your head. Good. Accommodation, convergence, extraocular movements intact. No nystagmus noted. Next, I'm going to dim the lights. I'm going to check your pupils. Looking at direct and consensual. Good. Equal bilaterally. Next, I'm going to look in the back of your eyes. Red light present. Medial disc and cup. Lateral fovea. Macula intact. Okay. Other side. Look straight ahead. Red light reflex intact. Medial disc and cup. Lateral fovea macula. Next, I'm going to move on to your ears. Looking at your ears, everything looks good, no swelling. Palpating the ears, no tenderness. I'm going to whisper words into your ear, repeat them back as you hear them.
Cat. Top. Nose. 1, 2, 3.
Good. Next, I'm going to take a look inside your ears. Pulling the pin out, back, and up. Tympanic membrane, pearly gray. Pulling out, back, and up. Tympanic membrane, pearly gray. Good. Next, I'm going to check your nose. Just looking at your nose, looks symmetrical. I don't see any trauma to the nose. I'm going to ask you to take a breath in. Good. Next, I'm going to take a look inside of your nose. Terminals are pink, no polyps. Good. Next, looking at your mouth, your lips are intact. I don't see any redness, I don't see any lesions. I'm going to open. Looking at your teeth, your gums are intact and there's no redness, no swelling. Looking at your buccal mucosa, hard and soft palate. Can you stick out your tongue? Can you lift up your tongue? No lesions. Put your tongue down. Stick it out. Say ah. Gag reflex intact. Uvula midline. Sorry. Moving on to your neck, your throat. I'm just looking at your trachea. Trachea is midline. I don't see any trauma. I don't see any goiter or any enlargement. Next, checking your lymph nodes. Pre-auricular, post-auricular, occipital, posterior, supraventricular, submandibular, submental, anterior. Good. Can you raise your shoulders? Good. Alright. Next, I'm going to check your thyroid by asking you to take a sip of water. Hold it in your mouth. Feeling for the Adam's apple. Putting your head down to the left. Swallow. Good. And we'll do that again. Feeling for the Adam's apple. Down. Right. Swallow. Good. Okay. Next, we're going to check your lungs. AP diameter 2 to 1. Good. Looking at your skin, again, I don't see any trauma. I don't see any scarring. I'm just going to feel here. Checking the same thing on the back. Next, I'm going to take a listen. I'm just going to ask you to take deep breaths in and out. Good. I'm going to do the same thing on the back. Next, I'm going to check your carotid arteries. Now I'm going to take a listen. Sorry, take a breath in and hold. can breathe normal. I'm gonna ask you to lean forward, checking for any heaves or pulsations. Everything looks good. Okay. Now I'm gonna take a listen to your heart. Aortic, pulmonic, Herb's point, tricuspid, mitral. Good. I'm gonna take a listen with the other side. Good. Now I'm gonna ask you to lay down. So with the other side. Okay. Next, I'm going to look at your abdomen. Checking your skin, checking for any trauma, bruising. Everything looks good. I'm gonna take a listen. Next, I'm going to percuss. Checking for the liver border. Take a breath in. Good. Now I'm just going to feel the rest of your belly. Okay, next I'm checking your arms, I'm checking your legs, I'm feeling your temperature. You're warm, no swelling noted. Next I'm going to check your pulses. Radial, femoral. Check your capillary reflex. Refill, capillary refill. Good. Okay. Next, I'm going to have you sit up. I'm gonna check your deep tendon reflexes. First, I'm gonna start with your tricep. Just relax your arm. Just relax. Move on to your bicep. Just relax your arm. Relax. Relax. Just relax your hand here. Take this off. Okay, next I'm going to ask you to hold your hands like this, and on the count of 3, you're going to pull them apart. 1, 2, 3. Okay. Sorry. Pull them against each other. You don't have to pull them apart. 1, 2, 3. Good. Okay, next. Gonna check your Achilles here. Check. Good. You can relax your arms. Okay, I'm gonna have you stand up. I'm gonna have you turn this way. I'm going to check your back. Put your hands together, and I'm gonna have you bend down, try to touch your toes. Good. Everything looks good, in line. All right, I'll have you stand up. Facing me. Have your arms here, twist side to side. Good. Any pain?
Okay.
And then arms down by your side, side to the other side.